Hello, everybody. I am Dr. Heather Wisely, Doctor of Acupuncture and Chinese Medicine, and I am here to talk to you today all about acupuncture for back pain. This is one of the most common things that acupuncturists treat and maybe one of the most widely studied topics there are. So before we get too deep into this topic, please take a moment to like this video and subscribe to my channel if you would like to learn more about acupuncture. So chronic low back pain is the leading cause of disability in the world, and current treatments help a lot of people, but they leave a lot of people still in pain. So there have been a lot of studies done on acupuncture for back pain. In fact, there has been so much evidence that currently the American College of Physicians recommends acupuncture as one of the leading treatments for acute back pain, subacute back pain, and chronic lower back pain. Now, when I decided to do some research, I got onto PubMed and I put in back pain for acupuncture with a 5-year limitation. And there were so many pages. But I decided to look at the first 7 systematic reviews that I found on the first page, and all 7 of them unanimously agreed that acupuncture is an effective form of pain relief for back pain. Now, these reviews looked at over 145 clinical trials with more than 25,000 participants. So there is a substantial amount of evidence, and honestly, I just kind of stopped looking after a little while. Now, not only is acupuncture effective for chronic low back pain, it's also effective for lumbar spinal stenosis. It's effective for pregnancy-related back pain, and it's also effective for osteoporosis-related back pain, and all of these have been scientifically validated. Now, a lot of people want to know how acupuncture relieves pain, and I went into a full video discussing the science behind how acupuncture relieves pain. Please check that video out if you really want to know more. But specifically regarding back pain, in just the last 15 years, there have been 19 studies published using neuroimaging technology such as MRIs and fMRIs that have shown that people with chronic lower back pain will have functional changes in their brain and structural changes in their brain after so much time with pain. And acupuncture actually helps to normalize abnormal activity within the brain, and it can even over time help to normalize the brain structure itself to relieve pain on a much deeper level than just normal pain relief. So a lot of people are really curious, how many treatments does it take? And studies vary. They go from as little as 1 treatment up to 20 treatments. Now, with a single treatment, fMRIs found that acupuncture was already working on normalizing the activity in the brain. However, for more lasting results, most of the studies used between 6 to 8 treatments, and they showed that that really helped to regulate brain activity. However, for long-term results, when they used 12 to 18 treatments, and usually these are several treatments a week, they found that that's when the brain structure itself started to change back to the way that it should be. And patients reported up to 3 or 6 months of pain relief after their last treatment. So acupuncture isn't always a forever treatment. A lot of people have substantial pain relief, but it can take a series of treatments. Now, to be honest, acupuncture doesn't work for everybody. It works for a lot of people, and a lot of people are scared of needles, and that's okay because we have a lot of other treatment options for you. People trained in traditional Chinese medicine can also do acupressure, where we put pressure on different acupuncture points. We are trained in doing Tui Na, a type of Chinese medical massage, and we're trained in herbs. And all of these have effective treatments for pain relief. So let's talk about acupressure just a little bit more. I've touched on this in some of my other videos, but this time I came across a study that actually looked at sham acupuncture. So when they're doing controlled trials, they're trying to find an acupuncture placebo, and there's 2 different styles that they use for this. In one style of placebo acupuncture called sham acupuncture, they will put non-inserting needles over acupressure points. And in another style, they'll insert the needles onto non-acupuncture points, and both of these have been found to be very effective. In the short term of acupuncture trials, if they don't look at a long-term relief, often sham acupuncture is performing about the same as true acupuncture, which has led a lot of studies to conclude that they are the same. However, on a long-term analysis, they have shown that 3 to 6 months later, true acupuncture clients did have better results. But I want to dive in a little bit deeper onto this non-inserting needle thing, because one of the modalities of Chinese medicine is acupressure, where we are stimulating points without necessarily putting a needle into them. And this non-inserting needle would certainly be a type of acupressure. So not necessarily a placebo, it's an effective treatment. In fact, there was a review that looked at 10 different trials that used placebo acupuncture, and they compared the non-inserting points on true acupuncture locations compared to not true acupuncture treatments. And what they found was that when we did non-inserting needles onto acupressure points, it was a very effective form of treatment, and that it is not a placebo. So we really need to go back into some of these trials that say acupuncture is no better than a placebo because it's the same as sham acupuncture, because sham acupuncture is a lot better than the placebo effect. And if you read the details, a lot of these studies also say that it outperformed traditional medications. So there's a lot going on there. So acupressure can be performed in a lot of different ways. Someone trained in acupressure may just do tapping. If you come across tapping, that is a type of acupressure. You can lightly rub on points. You can push into them, almost more like a trigger point therapy. But my favorite is actually using magnets that tape with a Band-Aid right on to different acupuncture points. So you can see this is a tiny little magnet, and we place it strategically right over different points, and then it stays there as long as a Band-Aid will stay, depending on how often you're washing your hands. So these are several different ways that we can use acupressure. If someone is scared of needles, there's different options. Not only that, but as I mentioned, we can do Chinese medical massage known as Tui Na. And what I really like about this is there have been 15 trials that showed that Tui Na was effective at relieving low back pain. And not only that, but it's a style of massage where you don't have to get undressed. Usually the practitioner will work directly over clothing and maybe even throw a blanket over the clothing. So that's one of the nice things about Tui Na. Now, on top of that, we have Chinese herbs, and not all acupuncturists are trained in Chinese herbs. So you want to find somebody who is, if that's something you want to look at. But there have been over 15 different Chinese herbal formulas in the last 500 to 2,000 years that have been tested for various types of lower back pain. I'm sure you can imagine there's a lot of types of back pain, and they all need a specific formula. We have traditional formulas that work for things that have been around for a long time, and now we even have modern formulas for things like bulging discs and bone spurs and stuff like that. But my favorite way of relieving back pain besides acupuncture is actually yoga. And our sister company, Wisely Living, actually created 3 different lower back pain videos to help people out with this condition. We have one where you lay down the entire time. We have a lower back pain video where you're sitting in a chair the whole time. And then we have one that's more of a traditional yoga class. So if you're interested in yoga, here are some different links to those videos. You should check them out. Now, as I mentioned, please make sure to like this video if you found the information to be informative, subscribe to my channel, and share this with anyone you know that might benefit from the information. Please check out my video description. I have links to all of the different references I used. I also have a link to my blog post where you can check all of this out in writing if that is your style and you can delve a little deeper into the science. Next week, I'm going to cover anxiety and depression. So please make sure to follow our channel so you can see that one. Thank you guys so much for joining. Have a great weekend.